Well, welcome. This is September 25th. It's a day that we've long been looking for. I'm Lynn McWright with Advancing Holistic Health Coaching Program. We're a program that prepares nurses to sit for the National Board Certification exam as a nurse coach. And also we have a certificate for health coaches. Any licensed health professional is welcome to qualify for that certificate through Advancing Holistic Health. My background is that I'm a nurse practitioner. My specialty area has been community health nursing. We started the online coaching program just 3 years ago. And when we opened, we actually opened on 3 continents. So the focus of our program always is resilience, and that's exactly the topic that we'll be addressing today. And here's Teresa. I'll have her introduce herself.
Great, thanks Lynn, I appreciate it. My name is Teresa Walding. I'm a registered nurse, bachelor's degree. I'm also a board certified nurse coach, and I have been working with Lynn, creating videos for the school and opening with her when we opened the school in June of 2016. It's just been an incredible ride. Learning about the principles of resilience has actually completely changed my life. I have to say that I did not know anything like this ever existed, and I am very grateful to have found it. I currently work with Lynn as faculty member at the school. So we do the classes on Wednesday evenings from 7 to 8:30. We also offer student advising, 2 student advising sessions per 20 hours of CE. And then the other requirement for the each 20 hours of coursework is 3 Wednesdays per 20 hours of class time, which is on Wednesdays from 7 to 8:30.
Central time,
yes ma'am. So Lynn and I are here to kind of describe what we do with our nurse coaching, why nurse coaching is the up and coming certification for nurses, and really bringing back what nurses do to every aspect of the work that we do. Whether you're a bedside clinician or an advanced practice RN seeing patients, to anyone who just wants to gain a better understanding of how to be more resilient.
Oh, thanks so much, Teresa. It's just been a joy working with you these last 3 years, and really looking forward to continued collaboration.
Mm-hmm.
Well, what I want to just introduce today is the resilience paradigm, because that's the basis of all of our coursework. And so if we were beginning just new with an understanding of the principles of resilience, the question is, where would we begin? So that's where we are today. And one of the little things that we use just as a shorthand phrase is something that we describe as flat earth thinking. There's a lot of outdated, outmoded thinking out there, especially in regard to the healthcare system, but just in society in general also. So what we're about today is to uncover some of our own outmoded thinking so we can release it and let it go. We're being told now that about 98% of what we think on a daily basis are thoughts that we have already thought before, over and over again. The same thing. There's no new information there. There's nothing to inspire us. So just noticing that, just standing back, observing ourselves as the thinker, allows us some space to see where our thoughts are going. And because we have freedom of thought, we have the option to change that, the direction of our thinking.
Just to add a little bit to what Lynn is describing as the flat earth thinking, is that flat earth thinking is things we've thought before, but they're things that we thought were real and acted as if they were real. It's just like when Dr. Semmelweis found out that there was actually something on the scalpel that he was using on women when he was delivering babies back in 1842, I think. I might be wrong on that date.
46.
But 46. And he was trying to make the correlation of why so many women were dying in childbirth. So one day he asked the midwife side of the hospital, because back then, one day they would go to the midwife side and one day they would go to the doctor's side to deliver their babies. They had, I think, when was it 16% or 13% mortality rate? The midwife side only had a 1% mortality rate. And he couldn't figure out what the difference was. And it bothered him a lot. And he chewed on it and toiled over it. And they would do autopsies on the women. Well, back then, no one knew to wash their hands. No one knew that there could be, quote, germs on something that could be transmitted to other people. So they were doing autopsies in the morning on the women that had died the day before. Using the same scalpel, they would step across the hallway and deliver babies, not knowing that they were then infecting the new women. So he determined at some point that there was something on the scalpel that was causing what they called then childbed fever. No one believed him. And it was like he could talk and talk and talk and say, listen, we need to wash our hands, we need to wash the scalpels. And his peers refused to listen. Well, we now know that there was actually something on the scalpel called bacteria. They actually didn't see it until Louis Pasteur invented the microscope 40 years later. So this is the kind of change that we're talking about when we're talking about resilience, of being able to see now what we're talking about as a true way of seeing human psychological experience as creating life, the life experience that we see. But we're proposing a new paradigm, and Lynn and I will try to do our best to describe that, but it's that kind of change that Dr. Semmelweis made in our life that we now understand we have to wash our hands to prevent other people from suffering.
So here's the man, Dr. Semmelweis, who actually coined the word germs, and wrote for the very first time the germ theory. So before that moment of insight on his part, germs did not exist. Or rather, humanity did not realize that germs existed. They have always been with us, but without knowledge of what they did or giving them a name, a term to call them by, they can be identified for what they did. And in this case, in the hospital in Vienna, 16% mortality rate on the part of the new mothers was really unconscionable. And the physicians knew that, and yet they didn't know what to do about it. There were lots and lots of theories. One went so far as to say that there should only be 2 patients in any one hospital, and that hospital should not be downwind from the other hospital. So it went on and on as far as what the theories were. Frightened patients, the disposition of the mother, cold, lots and lots of theories. And then when the germ theory came on board 40 years after it was written, and in what it was in fact adopted because of the scientific evidence, what happened was that all of those old theories disappeared immediately. They weren't given any credence whatsoever. So back to our little terminology, flat earth thinking, that actually came from the ancient maps that people drew of the world. And when mankind thought that the earth was flat, they would draw maps and picture dragons on the outside edges of the maps. So when the ships went sailing, they would take these huge anchors with them so they could drop the anchors and avoid falling off the edge of the earth. So here we are back again with another opportunity to see something newly. And that's something that we're looking at today really is, in one word, if we wanted to just give it one word, we could call it stress. But it involves every part of our personal and professional lives. It is what brings about burnout. It brings about bullying. It brings about relationships which are not collegial. So we have a long ways to go in regard to the healthcare system, and yet we have everything we need right here at hand today. And the best part of it is that there's nothing more that needs to be added to your plate to make it come alive. All we have to do is observe. We're going to stand back and notice what we're thinking. So there's a little, go ahead.
I was just thinking, you know, when you were saying that, is stand back and observe what I'm thinking. I cannot tell you how transformational that has been for me. You know, just to know that it's my thinking in any given moment, every moment, about whatever it is, and watching myself experience that from kind of like the mind's eye, and then realizing how personal that really is. It's a personal, life-changing experience when you see that kind of thinking creating life.
There's a little question that I love to ask myself, and it comes in handy lots of times. That question is so simple, and yet it's absolutely huge in its impact. The question is this. I ask, where do I think my feelings are coming from? So I'll say it again. Where do I think my feelings are coming from? In the past, we've always, when we had a feeling that was not comfortable to us, we've dived in and looked around and tried to figure it out and sought answers that weren't there and carried it around with us. And now what we find is that none of that works. Where do my feelings come from? Well, we might think of it as a coin, two sides of the same coin. So thought and feeling are exactly that, interconnected. You can't have a feeling without a thought. It's absolutely not possible to feel happy and think sad at the same time. So there's only one way that it works. And we call that living from the inside. Because in times past, we've seen stress as coming at us. We've seen ourselves as needing to fight or run away from that stress. And in fact, that's not where stress comes from at all. We actually are the origin of that stress through our own thinking.
You know, when I first learned about the principles of resilience, Lynn told me, it was actually a year or so before I actually found out what it was. And we were riding in the car, and we were talking about resilience, and I said, well, how do you learn it? And she was like, you can't learn it. It has to come to you through insight. And I was like, you can't learn it? What does that mean? How does that happen? And I wanted to know more. And I thought about it a long time. And then one day we went to the conference, the American Holistic Nurses Central Texas Conference in 2015, where Dr. Blevins described to us from logic how resilience is created. And it made perfect sense. I was sitting in there listening to his story and talking about how it is that it is our thought, our feeling in any given moment that creates whatever it is we see in our life. And I had this huge insight that I was the one that created this dis-ease or stress or pain in my life. And I couldn't believe it because it looked like the circumstances of my life at that time were creating my feeling. And they were big. They were big things, you know, a daughter with an alcohol problem that was going into treatment, a husband that has PTSD. So it looks like those are the stressors. And it wasn't true. And I knew it wasn't true. And that insight that I had that day actually relieved chronic pain in my body. It just kind of dissolved away. It was like I was sitting there and it just went away. And I thought, how could something this profound, this easy, in this few minutes of listening change my life? And I knew then that we had to bring this to other people. There's a lot of people out there who are suffering in similar circumstances and don't know how to make it stop or how to change it or to find any answers about it. And that's why we're here today, is to teach people to the best of our ability, to the best of our knowledge, so that you can have the insight of your own that helps you with your life. It sounds really fun to listen to someone else's changed life story and maybe be a little bit inspired by it. But our goal is for you to be able to have that experience for yourself.
Well, and I think that leads to our next segment, which really is something that we call separate realities. I can't know what your thoughts are, and you can't know what my thoughts are. We each quite literally live in a separate reality in that regard. And so just knowing that is going to release all kinds of tension and arguments that might have taken place. We're no longer in a position of trying to convince someone else of the way that we see things as being right according to us, because we can now simply recognize that they will think about it in a different way than we do. We can't have their thoughts. They can't have ours. So to the best of our ability and our communication skills, we can still have the opportunity to explain to another person how we see something, how our thinking works, and what it looks like to us in that moment. But to try to beat somebody over the head until they see it our way is no longer necessary. And what a relief that is.
You know, what comes to mind for me was the day that I saw what Lynn is talking about very clearly. And I have adult children. They're now 32 and 36. And my oldest daughter was going through a divorce. And I thought, being her mom, that I would know how to help her through this. And she would politely listen, and then she'd go off and do nothing. And I was like, what is happening? Why can't she, you know, get a job and do this and do that? And I thought, I was turmoiling over it, had a lot of extra thinking about it. I was playing the game of, well, if she doesn't do, what does that mean? The what ifs of life. And one day she was talking to me and we were driving. I still remember exactly where I was when this hit me, at the stoplight on Willow Springs Road. And she was telling me about what she wanted to do or why she couldn't do something. And I felt no need to explain to her or to prod her or do anything. And I looked at her and I said, well, Jennifer, you know, whatever you want to do, I'm here to support you. I want you to ask me for my opinion if you want it, but that's all that it is. I have no desire to control anything that you're trying to do. And if you can take my advice, fine. And if you can't, I'm fine with that too. And she just looked at me. She's like, really? I said, really? And so it was a week later, and she was, all of a sudden she's got a job and she's got a direction. And I thought, wow, this is like unreal. And she looks at me and she goes, you know, Mom, it's like you trust me to be an adult now. I like the new you. Now, I didn't know that that would happen. I just knew that I couldn't live her life for her, no matter how much I loved her, no matter how much I worried for her. I didn't also realize that the benefit to me was a release of more stress. I didn't have to be there to pick up the pieces per se, because she was doing it on her own. And it has continued that way. It's been 2.5 years now. And she's doing everything exactly like she wants to. And it's a completely different relationship. And she told me again the other day, she's like, remember that day you trusted me? And I was like, yeah, I remember the day I trusted you. She said, thanks. And I can't tell you the way that that made me feel was like, wow, how could something so small be so life-changing? That's the kind of transformation that we're talking about with the principles of resilience. Yours will be different than mine, but I still think that anyone who sees this will have a transformation in their life unlike anything they ever expected.
Wow. Truth is heard so deeply and by every human being on the planet. So we never know when something's going to sink in for somebody. The goal of all coaching is insight. And that insight is actually a sight from within, the person tapping into their own wisdom. We're no longer going to be standing over people, shaking our finger, telling them, you've got to do this. It never has worked. So now with nurse coaching, we have the opportunity to walk side by side with them, a little bit behind, just as a teammate and working together on their goals. So with insight, we never know how big the insight is going to be, and it can be completely life-changing in one major insight. Most people have a whole bunch of little ones all through their lives, and that's how we learn and grow. Up until now, insight really has not been given the credit that it deserves. But when we think about the way we learn to walk, did we actually go to the library and check out a book about how to walk? Or did we go to YouTube and watch a little video about how to walk? None of us did. And yet we all learned how. Just by putting one foot in front of another, wobble, 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 fall down 1,000,000 times, see mom walk, see dad walk, see the dog walk,
Yeah.
and figure it out that we can do it with 2 feet. But it was learned, not intellectually, but through experience. So that's what we're talking about now, learning through experience. And those aha moments can come to us when we least expect it. Usually when we have nothing on our minds, like stepping out of the shower, oh, that's what he meant. Or driving down the road, oh, I get that joke now, and laugh hilariously. But they didn't see it before. And even insight can be seen as hindsight. So in other words, sometimes we'll have an experience and we'll say, oh man, I'm going to do it different next time. Well, that is hindsight, and that's insight too. And it will serve us very, very well. So all of these things about insight are now just coming into their own. And, you know, we live in a society that has valued intellectual learning so much. And it's gone, um, well, it's time to bring the balance back to experiential learning as well. And in fact, now that I'm thinking about that, one of our objectives for today is to prove the efficacy of insight-based learning. And that's something that hasn't really been given credit in our academic settings at all. And we're going to see a new level of understanding in our healthcare institutions when insight is figured in as part of the equation.
You know, when I learned about the principles and I realized that insight could change my practice, because, you know, we go to work every day. We do the same things every day, most of us. I might learn something new every once in a while, mostly because I've been doing the recovery room for 20 years, but this brought new life to my practice. Before I found about the resilience, principles of resilience, I was ready to quit nursing, honestly. I was tired, my body hurt, it was a chore to get up every day. I just wanted it to stop. And when I learned about the principles and I realized, you know, the one insight I had that healed my body was totally amazing, I did not expect to get benefit in my professional life too. I didn't know that when I went to work that I was a changed person from the inside out. I didn't know that I could see my patients differently, that I could see they were separate people. Obviously, I knew they were separate people. And obviously, I knew they didn't see life the same way as I did, but I didn't judge them for it. Or I would have more compassion for the way they were seeing whatever was happening with them. And when I first learned about the principles, and this was beginning to happen in my practice, for about 2 weeks, people would wake up and start touching my face. And I was like, what is this about? Has never happened like that. Sure, there's been a few people here and there, but this was more than a few, because it was enough to catch my attention, that something was different about me, about the way I was seeing life, about the way I was seeing people, not just patients, but the person themselves. There was a big aha that allowed me to move past the daily tasks to see what else was there. And it was not an effort that I did. It was just something I became curious about. The other piece that happened was my daily work became easier. It was like I just began to take the next step and the next step, instead of wishing that everything was already done, or, you know, looking at the schedule for the day and going, oh, I wish this was over. I began to be more present in the moment with my patients, and the work became easier. I did not expect that. So when we're talking about insights and shifts in thinking, that's the impact that it can have for each of us. And I know lots of people are struggling every day just to get up and go to work. And how is it possible that the same job that I was doing before I knew this has become a joy to go to, has become an incredible way to connect with people that helps people on a completely different level, to include my coworkers. And I just can't say enough about it, I guess. I want everyone to have that experience, but I can't do it for them.
But here we are, putting it out in the world, and I'm so grateful for that. Speaking about change, the way that people arrive at change, making change, is through insight. So just as an example, one of our students was working in the emergency department the other night, and they wheeled in a young man, just 25 years old, too morbidly obese to walk independently. And he said, I want to make some changes, but I want to talk to the doctor. I want to know what is possible. So the nurse said, well, the doctor's over there, can't come right now, but let's have a conversation. And so as they were talking, the conversation came around, and she said to him, let's talk about calories. You know, calories are energy, and you are all fueled up and ready to go in any direction you want. Wow. He was so inspired by that. He had never felt such compassion from any healthcare provider. And of course, what was conveyed in the moment is that there are no limits to what can be accomplished. So he didn't have to hear from, he probably did, he was already there in the emergency room. He didn't have to hear from the doctor, I'll say, because he'd already heard what he needed to hear from the nurse. But it can be as small as a very tiny conversation like that, which can be potentially life-changing.
You know, we just had the experience. My husband has very bad knees, and we have been working, trying to get a new knee for him for about 4 years. So we went to another provider, and this is how transforming it can be when someone just acknowledges you as a person. But the man came in and he said, I see you're a big guy. He said, I'm a big guy too. He said, but we're here to help you. And gave him options. They were ready to do whatever needed to happen right then to help him with his pain. And we left there, and I swear to you, he walked with a different step. And then we get home a couple days later, and he's like, my knees don't hurt as bad. And I was like, are you kidding me? But he had an insight, not because the doctor said, hey, we can help you, but because there was hope for him. And he heard something different in that conversation, which I really think most people are looking for, is someone to say, listen, there is a way that we can help you have a better life, but it comes to you through an insight and then doing whatever it takes to make your life better. And so go ahead.
People will find their own answers.
Yeah. And that's what's happening. It's like I'm living with a different person, because he had an insight that there is help. There's something that can be done. He's not doomed to live in pain for the rest of his life, because that's what he thought he was headed for. And he lived as if that was true. And as soon as someone gave him an option that wasn't pain for the rest of his life, he grabbed a hold of it. And he's beginning to do the things that he needs to do to make that progression to being more pain-free. And I didn't really realize it was an insight on his part till he told me the other day, he's like, I think I now believe I can be helped.
Wow.
You can be, yes, that was always true. That was always true, but he didn't know it. And I was like, wow. And he said his knees aren't really hurting as bad as they were. Does he still need new knees? Yes, he still needs new knees, but he's not suffering like he was. I find that incredible.
Wow. So the pain is still there, but the suffering is gone.
Mm-hmm.
No, we can live with that.
Yeah.
Wow. I'm reminded also of one of our nurse practitioner students who had a woman with a very sad circumstance. She had lost 4 family members in 3 months. And this woman was just beside herself. She couldn't remember to check her blood sugar, give her insulin, take her blood pressure medication. And Jan just sat quietly with her, and she said, look, you can't be in 2 places at once. You can't be here now, taking care of yourself and living in the past with all your memories. And that lady just got fire in her eyes, and she said, "Do you mean to tell me that I can't take care of myself because I'm thinking about them? I've got the rest of my life to live." And 3 months later, she comes back and has more blood sugar checks than she had in the previous 3 years. And her A1C was ideal for her. So insight in the moment shows up in the labs 3 months later. It's not a mystery. There's body, mind, spirit, we're all one thing. We can't be separated out. Thought and feeling go together. If your thoughts are in the past, you're experiencing bringing the past into the present moment. We probably have a better way of saying that. So now we're going to talk about a new definition of resilience. And very, very simply put, resilience is not being bound by circumstances or the past. We have Valda Monroe to thank for that definition. I am just so moved by that definition. So I'll say it again. Resilience is not being bound by circumstances or the past. We've all thought that we had to carry our past around with us, and that it was something that was just going to be a weight on our shoulders. And I'm reminded of when the century turned in the year 2000, there was a picture on the front of Time magazine of the single most influential individual in the 20th century. Well, that individual was a physician. His name was Dr. Freud. And Dr. Sigmund Freud taught us that it was all about the past. It was your mother, it was your father, and we've been saddled with that ever since. Well, now we're going to take the lid off of that and see the truth about where we are in the moment, that it's only actually the moment that we are living in right now, and we can choose to bring the past into that moment, but that's the only way that the past exists, is in thought. We can choose to project ourselves into the future, and most of that is about anxiety. Well, tomorrow never comes, because when we're living today, when tomorrow comes, it's always today. So we're actually living only in the moment where we are at any given time. And just knowing that the definition of resilience is that we don't have to be bound by circumstances or the past gives us the freedom to drop all that extra thinking. So it's a process of subtraction that we're looking at now, and not through any doing on our part, but the simple logic. If you have less to think about, your mind is going to be more clear.
Mm-hmm. I experienced that at work one day with a very critical patient. And I guess it stands out because it was like the first time that I actually saw my thinking creating in the moment of a stressful situation. And I think I had her for, 5 or 6 hours, and we were doing a BiPAP so that she could breathe, because every time we took it off, she couldn't breathe. And, doing the lab tests and doing everything that came next. And as I was working, I noticed that I wasn't stressed about it. And so, taking the lid off and seeing your life in the moment is pretty incredible, because in that whole time, I knew that I was doing the best that I could. She knew she was doing the best that she could. And she finally stabilized, and I took her to the ICU, and she lifted the BiPAP off, and she said, "I want to thank you." She said, "I don't think I could have made it through this without you." And of course, I'm sure someone else that maybe would have taken care of her could have, but there was a connection, a human connection in that moment and staying present with her through that, minus the stress. So talk about hindsight, when I look back at it and it was all, quote, over, I couldn't believe how easy it was. I couldn't believe that I didn't second guess any decision that I made. And of course it was a team effort, but you know, the nurses are the ones that always call the doc and go, hey, you better come over here. This is happening. We need to do whatever. And I loved that feeling of knowing that that was possible, that it happened to me by staying present in that present moment. And of course, today that's a memory, and it still has a good feeling impact, but it's not anywhere close to what it was when it happened. But knowing that life is made up of that, that's a pretty incredible thing to think about, that this moment is all we ever have. And this moment we get to create or be or live or do whatever we want. That doesn't seem like a really big deal because the moments go so quickly. But that's exactly how we have created our whole life, one moment at a time.
So I think that this has a lot to do with working with our colleagues in a hospital setting, for example. It has to do with all of our life, of course, but I'm thinking especially of that because right now we're hearing a lot about bullying within the professions, and we're also hearing about a lot of medication errors that are being made. Well, all of that truly is because of distracting thoughts. And for us now to discover that we can just let go of those old thoughts and let go of the worry about the future means that we can actually relate to people, both colleagues and patients, in the moment from a clean slate. And we will have the opportunity to be so much more aware and observant of what will be happening for us. We're not actually going to know why they're acting the way that they're acting, but we can have compassion for them, and we can know that it's our opportunity to choose to react or not react. In other words, we can have what we might describe now as a respond ability rather than a responsibility to others. So I'm so grateful that that's available to us now.
I wanted to say something, but it's gone.
It'll come back. It'll come back.
I think what I wanted to say was that, you know, we have separate realities, and we talked about that a little bit, but that realizing that and knowing how you yourself have maybe not been the person you wanted to be, and having insight to that really allows us to have compassion for each other when we're not our best selves. Sometimes old habits die hard. And so it's hard for us to, you know that that's our thinking in the moment until after you've said something or did something that you really thought was unbecoming of you, and you wonder, why did I do that? Or, that's not really me. Whatever comes up with that. I know we all do it, where we're not the person that we want to be or want people to think we are. And what that did for me one day was I felt just this huge compassion for someone who I knew was struggling and was affecting the work situation. And all of a sudden one day I was like, she must be in so much pain to be doing what she's doing or thinking how she's thinking. And, we can look at other people and think we know what's going on, And as we know from separate realities, that's absolutely not true. And that just came home to me. I was like, I have no idea what else is happening or going on in her life. What I do know is she is feeling her thinking in the moment and responding or reacting how she wants to. And I have no business over there judging her for it. And I felt this huge sense of compassion for her and I thought I had compassion before, but this was different. It was bigger. It was profound for me to see that side of me that I had a holdout. I had a judgment that did not look like a judgment to me. And I saw that I actually did. Now we have those in all kinds of areas of our lives. And all we can do is have compassion, forgive ourselves, and move on. And if we see that again, hopefully we will respond differently. And if we don't, we forgive ourselves again and keep moving. Because we can't relive a past moment. We only have this moment in time, this present moment. And so I strive to do better. That's all I can do. Because I live in this human body, in this world, with all of my own thoughts and emotions and things that are happening. But it is the insight or the realization that I'm the one that's creating it that makes all the difference.
So we're no longer calling some experiences good and some experiences bad. We're actually giving ourselves the opportunity to have the full range of human experience and know that it's all okay and not judge ourselves either. So what we're doing is something that is I'm going to say practically unheard of in the professions. We're going to have compassion for ourselves.
Mm-hmm.
Now, Teresa and I are very fortunate that we've come up through the American Holistic Nurses Association, and there are 3 tenets, first of which is to take care of the patient as a whole, body, mind, and spirit. And secondly, include alternative modalities as appropriate, but not everybody is able to use lavender oil. Some people are allergic, for example. But the third tenet really is the most important. Take care of the nurse first. Wow. You know, and as we reflect on those words, it might seem like there's something for us to do. It might seem like we have a lot of work that we need to do on ourselves, or that we really need to be rigid with ourselves about a new diet, or we really have to put a lot of strong will into keeping to an exercise routine. It's shocking now for us to realize that it doesn't actually work that way. That when we have our minds free, when we're compassionate with ourselves, when we see through insight the steps that need to come next, there's quite literally no willpower involved. There is freedom of thought, but not willpower. The willpower that we've known about in the past has created change, but that change has not been long-lived. So now we have the opportunity for change that is lasting, lifelong change. Sometimes we'll see it, sometimes we won't. It'll disappear for a minute and then it'll be back. But we can trust our own inner wisdom here to know that when we've seen something that's totally true for us, it's an exact right answer for our situation. Not your mother's, not your father's, not your brother's, not your sister's situation, but your situation, because it was seen within yourself. It was your own insight.
It is life-changing. and it is profound, and it's very simple. We have a lot of words to talk about it, to try to point in the direction of how this works and why it's important. And the whole thing is not being bound by circumstances or the past, and seeing through insight, not by somebody telling you, not by somebody saying this is the way, but by the insight of your own, tailor-made for you, of how impactful it is, changes you at a level that I have never experienced. In fact, there's some times where Lynn will ask me a question about, remember that insight you had the other day about something? And I'm like, no, I don't remember. and it's like it doesn't exist anymore. It's like once it's healed, it's gone. And there's some things that she's asked me to remember, and I'll be really honest, I can't remember at all. Because who's the keeper of our memories? I'm the keeper of my memories. I'm the keeper of what was important to me in all the years that I've lived. It's just like when you have a sibling raised in the exact same house, but you have two totally different experiences of it. I'm the keeper of mine, and they're the keeper of theirs. And the things that keep coming up that say bother us, once those are healed through insight of whatever that means to you, there's just no reason to go there. And the less times you go there, the more you can't remember them. And I didn't expect that. So when Lynn asked me something like that one day, I was like, yeah, I have no idea what it was. And I still kind of get a chuckle out of it because sometimes I still wonder what it was.
Well, and I'm thinking about your daughter Jennifer's words. I like the new you. Well, you like the new you. You don't even remember what your problem was.
That's right. Go figure, right? Funny. And it's true. And I like the new me too, because there were parts of me that I thought I could hide from people or ignore or whatever you want to call it. Some people call it your darker side. I don't know. But, the side of you that tells yourself things that you're not enough or you're insecure or why what makes you think you can do that, those kinds of things. I see that for what it is, and it's silly talk. It's not true. And I find that I step out into things I wouldn't normally do. I'm open to things I wouldn't normally be open to. And that's a big shift. You're looking at the girl who cried the first time I had to say my name out loud in a group. I remember her too, So there's a lot of shifts that happen for people as they grow and change and learn. And that's all we can do is grow and learn to be the best people we can be, to help as many others as we can.
Well, I want to say thank you so much for joining us today. It's just been wonderful to invite you into our world and give you a little glimpse about the principles of resilience. It's such a delight for us to share this with others. And of course, we're looking forward to sharing it with all of our health profession and other licensed health professions. So I think at this point, I'll just ask Teresa if she has any last words. And are you good?
I'm good. I just appreciate everyone's attention, and I hope to hear from you.
Thank you so much for joining us today. We'll stay